My name is Kayla Gonzalez. This is the video assignment 1 resistance training program with 6 modalities with 3 variations for each modality with a progression and regression of each exercise. So with this one, we are starting with a general warm-up. I am on a treadmill at a 5 speed with no incline. This general warm-up is just a simple cardio, and we're doing this to aim to increase heart rate and blood flow in your body, raise your core body temperature and your respiration rate, as well as oxygen consumption. And this acts as a mental preparedness and some motivation to begin your workout. General warm-up is vital to your to pre-exercise, just so you can prevent injuries, get your body ready for a workout, and getting your body used to the things that you're going to be doing for the rest of the training session. Here you just remember to breathe, start sweating a little bit. It's not supposed to be anything super exhausting. It's just something to get your body prepared. Okay, so here for the next part of the warm-up, these are the specific warm-up exercises. We're going to do 10 arm swings. You're going to be standing upright. Your arms are going to be raised parallel to the floor, and you're going to swing your arms back and forth in front of you while facing forward. These are going to warm up your shoulders and your chest and your upper back, your latissimus dorsi, teres major, anterior and posterior deltoids, and pectoralis major. Next, we're going to do inchworm. You're going to start standing upright with a slight bend in your knees, and you're going to bend at the waist. And then place your hands flat on the floor. And you're really just going to be taking steps forward until you're like in a push-up position. And then you're going to meet your feet with your hands by taking small steps. And you're going to do this 10 times. These are going to warm up your erector spinae, gastrocnemius, gluteus maximus, your hamstrings, soleus, and anterior tibialis, so your back, your calves, your thighs, and your butt. With these, you're going to make sure you want to breathe and really feel your body moving. These specific warm-ups these exercises are specifically to prep you for the movements that you're going to be doing during the main segment of the exercise. Next, we're going to do a lunge with the overhead side reach. So you're going to be standing upright, you're going to lunge forward until your back knee is about 1 to 2 inches off the ground. You're going to reach up towards the sky with both of your hands, and you're going to bend your torso laterally towards your other leg. And then you're going to return to the erect position by pushing off the floor with your leg that's outward. And then you're going to repeat this for 10 times each lunge. This exercise works on your gluteus maximus, your hamstrings, latissimus dorsi, and internal and external oblique, as well as your rectus femoris, so your butt, your thighs, your groin, back, and abs. Next, we're going to do arm circles, 10 small, medium, and large ones. You're going to be standing straight up, and you're going to have your arms out to the side of you laterally. You're moving your arms in circular motions. You're going to start with small ones, medium ones, and then large ones. Next, we're going to do your walking knee lift. You're going to stand upright, feet shoulder width apart, step forward and lift your leg up to your chest, grabbing your knee and your shin to pull the knee into your chest. Then you're going to hold for a second, then release leg, and then step forward again and repeat. Next, we're going to do a heel-to-toe walk. You're going to be standing upright, again, feet shoulder width apart. You're going to take a small step forward and plant your heel into the ground. Bend at the waist and move your arms forward in a sweeping motion at the ground, and then return to the upright position and repeat. You're going to keep taking for every step you take, you're going to use the sweeping motion. These target your gastrocnemius, soleus, anterior tibialis. Next is the inverted hamstring stretch. 5 of these each leg. You're going to be standing upright. Take a step forward, bend at the waist, reach forward with your arms, and you're going to kick your leg backwards. And you're trying to aim for a position that you're parallel to the floor. And then you come back to a starting position and then just keep repeating as you take a step forward with each leg. These work on your gluteus maximus, hamstrings, hip abductor and adductors, as well as your erector spinae. Next, we're going to do a forward lunge with an elbow instep. You're going to do a really large lunge forward. Then you're going to take your arm and have it touch your elbow touching the instep of your leg. Then you take your opposite arm and rotate outwards your shoulders, really focusing on your shoulders. Bring it back, then come back to a standing position, the same as a lunge from earlier. And you're just going to keep repeating. These target your biceps femoris, erector spinae, gastrocnemius, gluteus maximus, hamstrings, latissimus dorsi, internal and external oblique, your quads, your rectus femoris, and your soleus. Again, to make sure to breathe through these exercises. All right, so for our first modality, we're going to be using a barbell, and for the exercise is a barbell curl. The first one we're going to be doing is a standing barbell curl. So you're going to be standing with your feet shoulder width apart, and you're going to hold the barbell with an underhand grip, keeping elbows close to the torso. Engage the biceps, and you're going to curl the barbell upwards until it reaches about shoulder level. And you're going to want to squeeze the biceps at the top, and then in a controlled motion, lower it back to the starting position. You want to make sure you breathe through these, keeping your core engaged. And then these target your biceps brachii, your brachialis, and your... Next one is the seated barbell curl. This is about the same thing. You're just going to be seated on a bench with flat feet on the ground. Same grip as before, and make sure you keep your back straight. You're engaging your biceps and curl the bar upward. And also lower the bar slowly under control to the starting position. This is the closed grip barbell curl. So you're going to hold the barbell with an overhand or pronated grip, keeping your hands shoulder width apart. Keep the elbows locked to the sides. Curl the barbell upwards, squeezing your forearms, and then slowly returning back to the starting position. This is a progression of a regular barbell curl. It is a little bit more difficult to do. And the seated barbell curl is a regression of the barbell curl, which means it is a little bit easier to do. So for the lower body barbell exercise, we're going to be doing a back squat. This is just a normal back squat as our first variation. You're going to position the barbell on the upper back or on your trapezius, and you're going to grip with a pronated overhand grip and make sure it's closed so it's secure in your hand. As you engage your core, you're going to keep your shoulder width apart, push your hips back, and lower into a squat until your thighs are parallel to the ground. You have to focus on pressing through your heels to return to the standing position. It's really important that you breathe through these. It can get difficult, especially if you've never done this before. And this targets your quads, gluteus maximus, your hamstrings, core stabilizer muscles, as well as your erector spinae. Our next variation is going to be a elevated heel back squat. So you're going to stand with your heels elevated on a plate of some sort. This is a regression of a regular back squat. Your range of motion is kind of decreased, so you don't have to go down as far. if you can't do that. So it's the same idea as a regular squat. You're gonna lower into a squat and making sure you keep your chest upright. You're gonna push through the balls of your feet and make sure you engage your core in this while keeping your back straight, and your knees are not moving inward or outward. These again target your quadriceps, your glutes, your core, and your calves. For our third variation, we're going to do a progression of the back squat, which is just a deeper range of motion back squat. You're going to perform the same squat as you would do in a normal back squat, except you're going to squat deeper than a 90-degree angle. So you're going to try to go down as far as you can while returning to the starting position. You need to make sure you maintain an upright torso and engage your glutes at the bottom, pushing through the heels to return to the regular position. So our second modality, again, is going to be a dumbbell. And this one we're going to be doing an incline dumbbell bench press. So you're going to be lying on an incline bench that's about 30 to 45 degrees. Hold the dumbbells at shoulder level with your palms facing forward. And you're going to press the dumbbells until your arms are fully extended. And then you want to control that movement on the way down and keep repeating. This exercise targets your pectoralis major, anterior deltoid, and your triceps brachii. Our second variation is going to be a flat dumbbell press. So what you're going to be doing is the same movements. You're just going to be lying flat on a bench, and you're pressing the dumbbells forward, controlled on the way down. And the same muscles are targeted here: the pectoralis major, triceps brachii, and your anterior deltoid. And for our progression variation is the increased eccentric tempo press. So it's going to be the same as the normal incline press, except as you're lowering the dumbbells, you want to take about 3 to 5 seconds on the way down, keeping control. And you kind of want to press back up in an explosive movement. This should be a little bit harder just because you have more resistance, you're using more time, and it is more tiring. And for all of these sets, you're going to do about 10 repetitions. Our second modality is going to be using dumbbells, and we are going to do our Romanian deadlift, or an RDL. You're going to stand with your feet hip width apart, holding the dumbbells in front of your thighs. As you go down, you're going to hinge at the hips, lowering your weights to your mid-shin while keeping your back flat as possible, which means no dips or anything like that. You're just trying to keep it straight. You should really feel your hamstrings and your glutes as you come back up to the starting position. These obviously target your hamstrings, your gluteus maximus, and your erector spinae. And you're going to do 10 of these. A regression of the RDL is going to be a single leg RDL. So you're gonna do the exact same movement except that you're gonna be on one leg and the other leg is gonna be kicking back to kind of help you keep balance. You want to make sure that you're really controlled on these, and if you need to go slower, then you can, because it's all about balance and control here. And the same thing, you're gonna be hinging at your hips, kicking your leg back, moving the dumbbell at your mid shin. Then you're gonna do 10 of each of these on each leg. For our progression of the RDL, we're gonna do an elevated heel RDL. So you're gonna stand on an elevated surface like a plate, heels on the plate, and these allow for a greater range of motion while you're lowering the dumbbell, so you can get deeper into the hinge movement. These are a little bit more difficult. It requires you to engage your hamstrings and glutes more when you have a wider range of motion. For next modality, we're going to be doing body weight, and our first one is a toe and elbow plank. So your starting position, you're going to be almost in a push-up position, except your elbows are going to be supporting your upper body, and you're going to be on your toes while you're going to be, like, you're propped up on your forearms and toes, basically. You want to make sure you're keeping your back straight as much as possible while engaging your core and your glutes. Your head, your back, your legs, everything needs to be in a straight line, pretty much. These target all of your core muscles, so your rectus abdominis, transverse abdominis and obliques, shoulders, and glutes. Our second variation is a regression of the plank, and it is your knee and elbow plank. So pretty much the same position, except that you're going to be, most of the weight is going to be supported by your knees. Same thing, same idea here with the regular plank, that you want to maintain a straight back, engage your core, and keeping your weight on your forearms. And you're going to hold this position. I'm aiming for 30 seconds for each, for these two variations. Although if you can go longer, then that's really good too. So for a progression variation, we're going to be doing an alternating shoulder touch plank. So you're going to be in basically a push-up position. And your hands are going to be shoulder width apart. And you're going to be lifting one hand to touch the opposite shoulder while keeping your hips as stable as possible, alternating sides in a controlled manner. You want to make sure you're not swaying back and forth too much and keeping your body as controlled as possible. For a lower body weight exercise, we're going to be doing a standard calf raise. So you're going to be in an upright standing position with your feet width apart, your feet hip width apart, and you're going to be pushing through the balls of your feet to lift your calf, your heels as high as possible, holding and going back down. The seated calf raises is the regression part. You're going to be sitting on a bench or a chair with feet flat on the ground, and then you're just going to do the exact same thing. You're going to do calf raises, except you're seated, pushing through the balls of your feet to lift your heels, pausing at the top for a second, and then lowering them back down. Next is going to be the elevated calf raise. You're on an elevated surface with your heels hanging off the edge. You're going to lower your heels below the step and then push through the balls of your feet to rise onto your toes, and then hold at the top and then come back down. You're going to do 10 reps of each of these. For the weighted plate exercise modality, we're going to be doing Russian twist with the plate. You're going to sit on the floor with your knees bent and your feet on your heels. You're going to hold a weighted plate with both hands at your chest level, lean back slightly to engage the core, and twist your torso to one side, bringing the plate towards the floor, then twist to the other side in a controlled motion. These target your obliques, rectus abdominis, transverse abdominis, and your hip flexors. Here I'm just taking a moment to breathe before my next set. So for the regression, it's the same thing, except your feet are going to be flat on the floor. This gives you a little bit more control over what you're doing. Same thing, you're going to hold the plate at your chest and twist back and forth while engaging your core. Our last variation is going to be the progression of this, which is elevated feet. It's the same movement again, twisting back and forth, engaging your core, leaning slightly back, except your feet are going to be in the air to increase the difficulty and engaging more of your core. For the lower body exercise with the weight plates, we are going to do a glute bridge. So you're going to lie on your back, flat on your back with your knees bent and feet flat on the floor. You're going to have the plate on your hips, and you're going to hold it with both of your hands. You're going to lift your hips upward, driving through your heels, making sure that your shoulders to your knees is in a straight line. You can see that right there. And you're going to squeeze your glutes at the top and then lower in a very controlled motion. This exercise targets your glutes, your hamstrings, and your lower back. And for the next exercise or variation, we are going to do a close feet glute bridge. So you're just going to bring your heels, your feet closer to your butt, and you're going to be doing the exact same motion as before. Lifting your hips, driving through your heels upwards, making sure your shoulders are in line with your knees. You can see right there, there's a straight line going from my shoulders right to my knees. Again, you're going to drive through your heels, lift up, squeeze at the top, and then lower in a controlled motion. And for our last variation, we are going to do a single leg glute bridge. So you're going to do the same movements again, only this time you're going to have one foot in the air. You're going to try to do the same motion, driving your hips upwards and pushing up through your heel that's planted on the ground. You can try, this is definitely the progression form of this. It is a little bit more difficult since you're using one leg to lift up everything. You're going to do both legs, trying to get that line from your shoulders to your knees. You can try to just see where you're going, working on your balance, and performing 8 to 10 of these reps. So for this modality, we're going to be using kettlebells, and the exercise is a tricep extension. We're going to be doing a standing kettlebell tricep extension. So you're going to be standing with your feet about shoulder width apart, holding the kettlebell with one of your hands behind your head, and you're going to keep your elbows as close to your ears as possible while extending your arms overhead until they are fully straight. Then you're going to lower the kettlebell slowly back behind your head. This mainly targets your triceps brachii and your shoulder stabilizers. The next variation is going to be a two-handed standing tricep extension. This is going to be a little bit easier because you have more control with both of your hands. It's very similar to the standing kettlebell tricep extension, except you're just going to have both hands gripping the kettlebell, which makes it more secure, ensuring control throughout all the movements. The last variation is going to be a slow eccentric tempo tricep extension. So you're going to perform the exact same tricep extension movements that we've been doing, but you want to take about 3 to 5 seconds to lower the kettlebell. This helps with increased muscle engagement and really works on shoulder and core stabilizers, as well as, again, triceps brachii. For a lower body kettlebell exercise, we're going to be doing a lunge step out. So you're going to hold the kettlebell next to you or in your opposite hand that you're lunging with. And you're going to step forward into a lunge, lowering your knee, both of your knees basically to form a 90-degree angle. And you're going to push back to the starting position. You're going to do 10 each leg here, so I'm just alternating one by one instead of doing all of them at once. This exercise targets the quadriceps, gluteus maximus, hamstrings, and your core stabilizers. You want to make sure that your knee isn't going over your foot. So you have control and make sure that your chest is up and your back is straight. Next we're just going to be doing a static lunge. So you're going to put yourself in the lunge position. And for this one, instead of having to start or move back to the starting position, you're going to stay in the lunge position and then just move yourself up and down. Again, you don't want your knee to go in front of your foot or in front of your toe. And you want to make sure that you're hitting 90 degrees for both your lunge leg and your back leg. Again, this targets the same muscles as before: the quads, the glutes, hamstrings, calves, and your core stabilizers. And you want to do 10 reps for each leg. For progressing variation, we are going to do a single leg elevated lunge. So your back foot is going to be placed on an elevated surface like a bench or a step while you hold a kettlebell at your chest. You're going to lower into a lunge position with the front leg, making sure to keep your chest upright and your back straight. Press through the front heel to return to the start. Again, making sure your knee isn't moving over your toe, and being controlled through the lunge and back up. Remember, these are a little bit more difficult, and I'm also dealing with a ACL injury, so these are a little bit more harder for me to do. But they are still doable, just a little bit more harder. That's why they are the progression of this exercise. Okay, so for this modality, we're going to be using a medicine ball, and our upper body exercise is going to be a front raise, or a standing front raise for our first variation. So you're going to stand with your feet shoulder width apart, holding a medicine ball with both of your hands in front of your thighs, and keeping your arms straight. You're going to lift the ball to the shoulder height, and then lower it back down. The next variation is going to be seated front raise. So you're going to sit on a bench with feet flat on the ground. Again, hold the medicine ball out in front, arms extended, in front of your thighs, and raise it to shoulder height. And again, lowering it back down in a controlled manner. These exercises will target your anterior deltoids, upper chest, and your core stabilizers. This regression is really good. It's almost the exact same exercise. You can just have a little bit more stability as you're sitting down. And you want to make sure that your back is straight and upright. Our third variation is, again, standing. But this time it's going to be slow eccentric. So as you're coming down, you want to take your time, about 3 to 5 seconds, in a controlled manner, and then lift it back up explosively, and then down again for 35 seconds. Yeah, this is a progression that makes it a little bit more difficult. And here I'm using an 6-pound medicine ball. And for each of these, you're going to do 10 reps. And for a lower body exercise, for the medicine ball, we're going to do step-ups. So you're going to have a medicine ball in your hands, holding with both hands. You're going to have it in front of you, like at chest level. You're going to step onto a sturdy box or bench, or in this case, I have a thing that sticks out. It's pretty sturdy. And with one foot, you're going to step onto it, driving through the heel to stand up fully. And then once you get up, you're going to lower back down and then repeat on the other leg. These target your quadriceps, your gluteus maximus, hamstrings, and again, your core stabilizers. For our regression, we're going to be doing the exact same thing. We're just going to have a short box. So as you can see, I lowered the platform to as low as it could go. And I'm going to be doing the exact same thing, holding the medicine ball right in front of me at chest level, stepping up onto the box, holding for a slight second, and then coming back down, and then doing it with the other leg. These are going to be 10 each leg. Finally, for our progression, we're going to do medicine ball step-ups, but eccentric, slower eccentric tempo. So on our way down, you're gonna try to do 3 to 5 seconds. As you can see, I'm struggling with these. These are difficult for me. Again, with my ACL injury, it's difficult for me. And also on my left leg, you can see my ACL is not helping me. But these are pretty difficult for progression. But it does, make you use your quads a lot more, engaging them more. And for these, you can do as many as you can, shooting for 10, but I think here I only did about 8. Or maybe more, I don't know. It was very difficult. And if you really need to, for these, you can use like a wall or some kind of stable surface in front of you to kind of hold on and keep yourself sturdy and controlled all the way down. Okay, so we finally finished the main training section. Now we're gonna move on to our cool down segment. So the purpose of a cool down is to return our body to resting or baseline state, which is just trying to bring our heart rate back down, our breathing rate down. We also want to start muscle relaxation and increasing our flexibility to prevent injuries and also relax our mind. Cool down is important so you can your body you give your time or you give your body time to recover and slow down instead of basically staying in the state that it was, like the stress state that it was, and then leaving it like that. Like you want your muscles to relax and stretch so you can have a better recovery. Here for the general part, I am doing a brisk walk on the treadmill. So I'm at about 3.5 to 4 miles with no incline, and I'm just, walking pretty fast. I'm still moving my body, but I'm cooling down. My heart rate is still going down. And then eventually I'm just gonna go to a slow walk. That's really gonna get my breathing down and my heart rate down. And in this entire time, I am trying to focus on slowing down my breathing, taking deep breaths, and just relaxing. And after this, we are gonna go into static stretching. So for static stretching, this is usually done at the end of resistance training or anaerobic training. This is to increase or improve your flexibility and your range of motion or your ROM. This is also going to help with recovery. And when you're doing these static stretches, you want to hold them for about 15 to 30 seconds and to the point of where it feels uncomfortable but not necessarily painful. So here I am going into the slow walk. I'm here, I have my hands on my hips. I'm just focusing on breathing and slowing everything down, but not coming to a completely abrupt stop. So back to the static stretching. Static stretching relaxes the muscles, which again aids in recovery. It was shown to prevent soreness, but research is a little bit undecided on that. And it can also prevent injury. The more range of motion that you have in your joints and flexibility in your muscles, the least likely you're gonna have an injury. And again, consistent static stretching can improve your range of motion over time, and is probably one of the most beneficial activities an athlete can do after stretching or after exercising, as well as just doing it on its own in its own separate session from training. Okay, so for our first static stretch, we're going to be doing straight arms across or behind the back for 15 to 30 seconds. While you're standing in place, about feet shoulder width apart, you're going to place both of your arms behind your back, interlocking your fingers, or if you can, here I'm kind of holding my wrists. And you're just going to try to straighten your elbows fully. Our next stretch is behind neck stretch. You're going to be standing, you're going to abduct the shoulder and flex your elbow, reaching your hand down towards the scapula. You're going to grab your elbow with your opposite hand and then pull behind the head. And you're just going to pull it, shake it out a little bit, and then do the opposite arm. This stretch works on your triceps brachii and your latissimus dorsi. This stretch is going to be the cross arms in front of chest. So you're gonna stand, elbows slightly flexed, and then you're going to pull your arm across your chest. And I'm using my forearm, but you can use your hand, and you're gonna grab at your elbow and then pull even more across your chest. You're gonna do these for about 15 to 30 seconds each arm, until you feel slight uncomfortability, but not pain. This one is kind of a mix of a semi-leg straddle and also a toe touch. So you're gonna have one leg extended out in front of you, and then your other leg kind of pulled in. You're like the bottom of your foot almost touching your knee, or as far in as you can pull it. And you're gonna be reaching for your toe, or if you can go farther, then go as far as you can. But if you have less mobility or flexibility, then just go as far as you can forward, like grabbing your ankles. Again, you're gonna want to hold these each leg for about 15 to 30 seconds. These kind of reach everywhere, so your spine, your lower back, your quads, your hamstrings, your calf. You can see there I'm kind of pulling my toe back a little bit. That can help you stretch your calves as well. And again, you're reaching out as far as you can. Here I'm grabbing my ankles. I don't have that much range of motion here, as you can see. And just remember to keep breathing through all of these. This next stretch we're going to do is a calf wall stretch. So you're going to be standing facing a wall. And you're going to put like your toes or the balls of your feet onto the wall while your heel is pressed into the ground. And you're going to kind of lean forward towards the wall as you're stretching this, using your hand to support. You can see here, like, the lower you go, meaning your toe, like, as close as your toe getting closer to the ground but still leaning on the wall, the higher you go up, the more stretch, I guess, you can feel. So, and you can see I'm also leaning forward to give me more stretch into my calf area. This next stretch is a quad side stretch. So you're going to be lying down on your side and using your forearm for support with a slight tilt. And then you're going to bring your foot back close to your, like, pulling towards your butt, basically. And then you're going to use your arm to grab your ankle and pull it even more towards your butt. Again, you're going to hold this for 15 to 30 seconds for each side. Next is the straight arm side bend. You're going to stand about shoulder width apart, feet shoulder width apart, interlocking your fingers with your palms facing away from you and reaching upwards with straight arms, or arms as straight as they can be. There you go, I fixed them. And what you're going to do is lean at your waist from left to right on each side, holding for about 15 to 30 seconds. This stretch targets the external oblique, latissimus dorsi, and you should probably feel it, like, on the side of your torso and all the way up to your armpit. Next, we're going to do a sitting toe touch. So you're going to sit down with your legs straight out in front of you, and then you're going to lean forward, trying to grab your toes with both of your hands. And then you're going to try to pull your chest to your legs and also your toes to your chest. Now, if you can't reach all the way to your toes, going as far as you can, ankles is fine. Here you can see, like, the more I do the stretch, the further out I can go. So if you can keep going, then try to keep going. This targets your hamstrings, your erector spinae, and also your gastrocnemius. Then we're going to go into the butterfly. You're going to sit with your body almost vertical, and then your legs are straight, but then you're going to flex both of your knees, bringing the soles of your feet together in front of you. You're going to try to pull both of your feet closer to your body, like towards your body. And then if you need to, for more stretch, you can place your hands on your feet and your elbows on your legs. And then pull your torso towards your toes. Here you can see I'm pushing out here with my elbows on my knees. You're going to pull your torso slightly forward as the elbows push down, causing hip abduction. Here, I feel like I can't really go that far out, so just doing this will be good enough. And this targets your hip abductors. Lastly, we're going to go into the forward lunge. So this is almost exactly the same as doing a regular lunge. You're going to, take a long step forward as if doing a normal body weight lunge, keeping your front foot flat on the floor. And then resting your hands on your hips or the front of your leg. You're going to push your hips or lean your hips forward and down so you can feel the stretch in your hips, your hip flexors, and your rectus femoris. Then I'm going to switch sides. Do it again. Remember, pushing your hips forward and down. You can kind of see it well. I did it right there. Holding it. I'm going as far as I can without feeling pain. Remember to breathe. So this is our last exercise, and after this you are done with the cool down section of the training program.